Thank you all again for coming back today and for tuning in. And I do know that these daily briefings can get tedious and the information, much of it sounds the same. And so people may start to tune it out, but I can tell you the situation is changing, it's evolving, and the information that we're putting out is important. And just because the social distancing and hygiene guidance and the stay-at-home order remains in place day after day doesn't mean we shouldn't talk about those things, because that really is going to be the key to success in trying to get through this public health emergency with the fewest amount of cases and certainly the lowest death total. I want to thank Dr. Corey Hebert for being with us today. He's been a practicing physician in New Orleans for decades, although he doesn't look that old. I'm told it's decades. He's the Chief Medical Officer for Dillard University. He's a professor at LSU and Tulane, and he is also working with the State Office of Public Health. And it's great to have you here today. He will take some questions. He will have some prepared comments and take questions after I'm finished. We obviously have Dr. Alex Bu as well from the Department of Health to take questions related to testing and other things. You know, Dr. Hebert is here today because we mentioned a couple of days ago for the first time some disturbing statistics coming out of our analysis of the information we're getting, and that is that while about 33% of the state's population is African American, over 70% of the deaths in Louisiana because of COVID-19 are among African Americans. That is very concerning to me and to others, and it's unacceptable. We want to better understand why that is, what we can attribute it to, and then how we get rid of those disparities over time. But are there any interventions we can make in the short term that will lessen this? And of course, all the guidance on social distancing, on staying at home, and hygiene, they apply to everyone. And that is in the short term what everybody should be trying to do to minimize the chances that they will contract this disease. Today we are reporting 746 new cases. And you can see that the total number of cases is now just over 17,000. It's 17,030. That's a little lower number than we've been seeing for our daily case growth. But I want to, again, remind everyone that we cannot let our guard down, because if we are seeing fewer cases, it is because of the efforts that we are making in order to minimize contact with other people. And so we have to continue to be focused and continue to be patient. Unfortunately, like yesterday, we were again reporting 70 deaths. One is too many, but this number is still much higher than we want it to be, obviously. That matches yesterday and matches the highest number of deaths that we've reported in a daily reporting period. Again, not all 70 of those individuals expired yesterday or within the last 24 hours, but that report came in today. We have 1,983 hospitalized patients who are COVID positive. That's actually a little bit down from yesterday, which was 1,996. But if you look at COVID positive and persons under investigation who are together hospitalized, if you look at both of those numbers are up by 238. And at this point, the vast majority of individuals who are under investigation, meaning they've got the symptoms, they need hospitalization, they've had a test, we're waiting on the result to come back, those individuals, the vast majority of them at least, will be COVID positive. So overall, the hospitalization number is up. But the rate of growth in hospitalizations is in line with us being on a lower trajectory for case growth than where we were last week. There's also some good news with respect to ventilator utilization. Today, that number is 490, where it was 519 yesterday on COVID positive patients. And it's also down if you look at the entirety of the hospitalizations for COVID positive and persons under investigation. So that is a good trend, and it is due in large part to some medical practices that are in some cases being pioneered here in Louisiana to keep people off ventilators in the first instance and to wean them off earlier than otherwise would have been the case before. And there's some things that are being developed here, lessons learned here, that really do constitute best practices that other parts of the country are starting to pay attention to. And Dr. B, you can talk more about that later if you're interested. And so where we are on the modeling, because I know we've had questions about that every single day, the simple fact of the matter is that the number of new hospitalizations suggests that we're trending in the right direction. But thus far, the number of deaths is higher than we want it to be to have corroboration of that. And so the two most essential data points are not in agreement. Overall, we think we probably are heading in a better direction with a lower trajectory, and that we're starting to flatten the curve, but we can't be sure yet. But what we do know is if people misunderstand what I'm saying and they start to thinking, oh, we've got this thing where we want it now and we're moving in the right direction, therefore we can let our guard down and I can start having my dinner parties and I can start doing what I want to do, we're going to see those cases spike right back up. And so I'm encouraging everybody, imploring everybody to make sure that you continue to comply with the stay-at-home order, that you continue to engage in social distancing when you're out. If you're going to be out and in close proximity to other people, it is now a CDC recommendation that you wear a face covering, not necessarily a surgical grade mask or an N95 mask, which those things continue to be in short supply for our healthcare providers. So I'm specifically asking that you not do that, but that you find some face covering that you can use. There are anecdotal reports and that we have more people out and about on the streets today around South Louisiana at least than was the case yesterday. And I hope that's not true, first of all. And I hope that nobody received the information we put out yesterday as any sort of an indication that we can relax and let our guard down, because that is exactly wrong. And in fact, our messaging here in Louisiana and the messaging coming out of Washington, D.C., whether it's the president, the vice president, Dr. Fauci, it is entirely consistent. And his end date for the 30 days to stop the spread and my end date on the current executive order, both are April the 30th. And as we get closer to that date, we will reevaluate the situation and see what things will look like after April 30th. But we need everybody to be very patient. We just recently learned that Louisiana health centers are going to get nearly $27 million. There are 36 such health centers across the state of Louisiana. These are federally qualified health centers. They're going to get $27 million through the CARES Act. That was our allocation, and that is very helpful because it's going to help us to detect the virus and prevent, diagnose, and treat the disease, COVID-19. Region 1, which is the New Orleans, Jefferson Parish area, continues to be the biggest hotspot in our state. We are closely watching Region 2, which is the Baton Rouge area, Region 3, which is South Central Louisiana, and Region 7, which is the Shreveport area. That is not to say that we aren't watching every single region of our state, but we're analyzing the data every single day, and those are the areas that we're paying the most attention to with respect to case developments and hospitalizations and deaths. As a proactive measure, we're sending 45 ventilators today that came from the Strategic National Stockpile. So the last 200 that were approved on Friday that were received over the weekend, we're sending those to the Shreveport area. And we are continuously in the process of communicating with hospitals to ascertain what their needs are and then to allocate resources accordingly. We are watching the entire state, as I mentioned a while ago, and we want to make sure that everybody is trending in the right direction. And it goes without saying, I think, that some areas of the state are behind others because we know that this virus seeded pretty heavily throughout the New Orleans, Jefferson Parish area earlier than it got to other states. And so trends that are true in one part of the state may not be true in another. And so we have to watch all of this very carefully. I'm also pleased to say that today in Shreveport, we're standing up a testing center at a Walmart facility. This will be the first of its kind in our state. It will test first responders, healthcare workers, and people who are over 65 and that are symptomatic. It'll be a relatively soft opening today to make sure that the process is correct, and then it will resume tomorrow. And we're also on track to have a similar testing set up in St. John the Baptist Parish in LaPlace at a Walmart on Saturday. Again, with a soft opening on Saturday for the same categories of individuals. They will then close for Easter Sunday and then reopen again on Monday. One other note about the New Orleans area, and I do this to try to make sure that we're completely transparent and that rumors don't get a foothold. The Carnival Valor ship, this cruise ship, the home port is in New Orleans. It is coming into port without passengers but with crew. 300 crew members who have tested negative for COVID-19 and who do not have any symptoms will get off the ship. Will board buses that are chartered to take them to the old airport terminal in New Orleans, where they will board chartered flights and go back to the countries where they live. Other crew members who have tested positive will stay on the cruise ship. They will not get off, and right now none of those individuals require hospitalization. However, if any of them do require hospitalization, we will take those individuals into our hospitals in New Orleans. There have been a lot of organizations that are working to help get these crew members back home safely, in addition to Carnival, and they include the CDC, the Louisiana Department of Health, the City of New Orleans, the Coast Guard, and the river pilots and the Port of New Orleans. And I want to thank all of them for working so hard to make this happen. We do have a little bit of good news when it comes to unemployment benefits. Last night, we received the funding that was contained for Louisiana in the CARES Act. So it will enable us to start paying unemployment benefits in the amount of $600 per week, in addition to the standard weekly amount that you get through the state benefits. And that will go through July 31st. I have instructed Secretary Ava Dashwa, the Louisiana Workforce Commission, to begin making those payments on Monday. That's Monday, April the 13th. And this includes, and this is really important, this includes the 1099, the salon, the gig, and other self-employed workers who had a benefit coming through the pandemic unemployment assistance, but that funding wasn't received until yesterday. We will begin making those payments on Monday. So we continue to urge people to file their initial claims and to continue to do their weekly recertifications. Both of those things are important so that you can qualify for and continue to receive unemployment benefits. And while it may be somewhat inconvenient, although we're asking you to stay home, so hopefully you can make this work, the best hours to file are between 10 p.m. and 4 a.m. just because of the volume, and to do it online. The website is louisianaworks.net, louisianaworks.net, and I encourage people to file their claims, do their weekly recertifications, do it online, and try to do it during non-peak times, and you won't have as much trouble getting through, and it won't take you as long. I do want to give you an idea of the volume of claims that the Louisiana Workforce Commission has handled over the last 4 weeks. Between March the 1st and April the 4th of this year, there have been 277,000 Louisianans who have filed with the Workforce Commission for unemployment benefits. In contrast, in all of 2019, the number of claims was 103,000. This week, from April the 5th through the 8th, Louisiana Workforce Commission paid $25.5 million in unemployment insurance benefits from our trust fund. In the two previous weeks, they had paid $21.2 million and $4.8 million for a 3-week total of just over $51.5 million. In a typical week before COVID-19 came to Louisiana, weekly benefits in the aggregate totaled about $2.3 million. With Office of Motor Vehicles offices closed around the state of Louisiana, I do want to remind you that the LA Wallet app is free. So I'm encouraging people to go and download that app. Additionally, some people will be eligible to renew their driver's licenses through the apps, even while the offices are closed. And there is usually an $18 convenience fee associated with renewing your license through the app. That will be waived during the pendency of this emergency. Now, you can only renew your driver's license through the app if this is not your time to go in and have your eyes checked. So if the last time you renewed your license, you went in and you had your eyes checked and you did those things, then you can renew your license this time on this app, again, without having to pay the $18 convenience fee. So I would encourage people to go to use LA Wallet for that purpose. I also want to share an important announcement from Bristol Myers Squibb. They're going to help unemployed patients in the United States who've lost their health insurance because of the COVID-19 pandemic. They've expanded their patient support program to offer access to any Bristol Myers Squibb medicine for free to those who need it. The program will be in effect for 6 months. Once the program ends, patients already enrolled can continue on the program until such time as they secure insurance. All Bristol Myers Squibb patient support programs, as well as additional eligibility requirements, can be determined if you call 800-721-8909. That's 800-721-8909, or by visiting bms.com. bms.com. Finally, before I take questions from you all, actually I'm going to yield the podium to Dr. Hebert, and then we'll come back for questions. I'm going to take a couple questions that have been submitted from members of the public. We started this yesterday. Questions can be emailed to askjbe@la.gov. askjbe@la.gov. I think we received about 700 questions. We're going to take 2 of them. Lisa from Tickfall asks, I am from Louisiana but traveled to Texas to visit family. Will I be able to travel back to Louisiana? The answer is yes, you will. There have not been restrictions on travel to and from Texas. Here is what's happening for vehicles that are not from Texas. And by the way, these are not just Louisiana vehicles. This is any vehicles entering Texas, regardless of the state they come from. On those major routes, Texas DPS troopers have set up screening points at the state lines where they're stopping vehicles at certain intervals. They flag about 6 to 10 cars that they then direct into a screening area at the Welcome Center. And then while they screen those cars, the traffic flows uninterrupted into the state. So they're stopping 6 to 10 cars at a time. The rest of the traffic continues to go. For the traffic that they stop, they inquire about where the motorists are traveling to, and they ask them to quarantine for their first 14 days if they're going to be staying in Texas. They may be asked to fill out a form about their destination. It continues to be the case that no commercial vehicles are being stopped. The state police here in Louisiana have not seen any significant delays or backups because of this, but additional troopers have been deployed around the state line should they have problems such as breakdowns and traffic delays and that sort of thing. Jennifer from Labadeville asks, when do you anticipate, if everyone follows the stay-at-home order, we will be able to go back to our daily lives as we knew them before? First of all, I appreciate all the questions, and the premise of this question is, if everyone follows the stay-at-home order. That is very, very important, because I promise you, no matter what the timeline looks like, it's going to be quicker if everybody follows the stay-at-home order. What we know is that the virus is going to dictate the timeline, not us. We're not going to be able to pick a date on the calendar. I think Dr. Fauci said it yesterday or the day before. This is not like flipping a light switch where the lights are either on or off. We do believe we're beginning to see the flattening of the curve, but we then have to come down on the other side, and we know that cases can spike. For example, somewhere around 95% of the state of Louisiana will not have been infected if this virus goes away quickly. That means they can be infected later on. And so until such time as there's an effective, clinically proven therapeutic intervention, some drug that can treat this disease, and a vaccine, I don't know that you're going to see life as we knew it before COVID-19. But there's going to be some transition period. Exactly what that's going to look like, when it's going to start, how long it's going to last, I cannot tell you today. We're going to be leaning heavily on the federal government, the CDC, people like Dr. Fauci and others, and with our Department of Health. It is going to involve an awful lot of testing to determine who has it, contact tracing of those individuals, and a lot of isolation. But we will be easing back towards life as we lived it before COVID-19. But that's going to be some period of time in transition. And I think everything that I'm saying today is fully consistent with what you hear out of the federal government at this time as well. Although I do look forward to the day when we can start to reopen the economy. I don't know when that's going to be, and when people can start to move about more freely and so forth. But I do appreciate the questions. So at this time, I'm going to ask Dr. Corey Hebert to come up and deliver some prepared remarks. I would ask that if you have questions for him about the subject matter he's going to discuss with you, that you ask him while he's at the podium. And then when you're finished with that, if he wants, he can stay or he can depart. And then Dr. Bu and I will stay and answer your questions as always. Dr. Hebert.
Thank you. Just want to tell everyone to take a big breath, and we're going to be okay. Governor Edwards, I want to thank you for your leadership, because without it, we would be in a much more dire circumstance. I'm just happy to be home. I am from Baton Rouge, although I reside in New Orleans. I grew up in an area that most of you may know called the Greater Eden Park area. And growing up in that area, I witnessed firsthand how the lack of medical care can directly cause an entire community to have unrelenting global issues. Thomas Paine, in the work The American Crisis, wrote, "These are the times that try men's souls." Well, ladies and gentlemen, I will tell you, at this time we are definitely in a crisis, and the soul of the state of Louisiana is being tried. The coronavirus is ravaging our state in the form of a disease called COVID-19, and specifically the numbers of African Americans who have succumbed to this disease is clearly disproportionate to the absolute number of black people who reside in this state. The explanations for this are multifactorial, and I will try to elucidate some of these issues today, as well as give solutions, and finally try to give some hope and inspiration to my people's fight against the scourge of this pandemic. We know that this is a really difficult issue. We know that African Americans are very smart people and descendants of kings and queens, and we are not any way weak or shiftless or slothful in the quest for wellness. Every citizen needs inspiration to find the fortitude to reach a collective goal. The challenge is, if on your road for excellence there is a roadblock, and then another roadblock, and then another roadblock, and after some time you see another one, you get a little weary. But as we sit at this crucial juncture, surrounded by this carnage, as African Americans, we cannot and must not be weary. This is a defining moment for this generation of African Americans and Americans as a whole, because we must rise to defeat this monster. Our goal is to energize and to focus our African American brothers and sisters on the true goals presently in our view, the goals of survival, the goal of thriving, and the goal of ultimately having full responsibility for your own well-being, and not based upon the roadblocks, but based upon your ability to hurdle those aforementioned roadblocks, which were sometimes inadvertently and sometimes strategically put in your way. I'm not going to preach. That's not what this podium is for. However, I need you to understand it's our job as a total society, not a black society, to protect the vulnerable, and African Americans are the most vulnerable by being disenfranchised and systematically marginalized for generations. We know that the HIV/AIDS epidemic, and now through coronavirus, this pandemic, these disparities have obviously reared their head yet again. We in the medical community have been well aware that this was a looming threat for a very long time, and we watched this as it spread throughout China and arrived at our borders. As I quote Dr. Anthony Fauci yesterday, this disease will shine a very bright light on a weakness of our society. As we negotiate this pandemic, our path invariably begs the question, why are blacks being affected in this way? We are your service industry. We're the people driving your trucks to deliver goods, and all that's true. But there's overwhelming data which points us squarely to the social determinants of health, as defined by the Centers for Disease Control and Prevention as conditions in the places where people live, where people learn, and where people work and play. For public health professionals, these are the cornerstones that we use to evaluate and in turn bolster our care in the midst of all distractions and turmoil. And it stands to reason that African Americans have historically been overlooked on the path to wellness that these categories lend to. When we think about trying to tip the scales so that African Americans can have equitable care, it's a tough road. It's a very tough road. But what we have to remember is that we will tip the scales in the favor of the black population, but make no mistake, this is in no way any bootstrap movement that I want you to pull yourselves up by. If we are to get it to a better place, we need statewide support, which I've been assured we will have through our great governor. I am actively working with Dr. Alex Bu with the Louisiana Department of Health and the Office of Public Health to roll out a phased approach to address the alarming death rates in proportion to the reported cases. The trend of desperate black and minority deaths under Governor Edwards' leadership, as soon as the data revealed this disparity, he has worked tirelessly and immediately commissioned and supported key statewide officials to work with Dr. Bu to educate various distressed communities and employ additional strategies. And this is what I want people to understand. I could surround you right now with so much data from erudite scholars, and I do want to give you one particular case. There was a study that was put out about 17 years ago. It was the publication of the Institute of Medicine's Unequal Treatment Report, which synthesized a wide body of research demonstrating that U.S. and racial and ethnic minorities are less likely to receive preventive medical treatments than whites, and often receive lower quality care. And most startling is the analysis found that even after taking into income, neighborhoods, comorbid illnesses, and health insurance, these factors typically invoke to explain racial disparities. Health outcomes among blacks in particular were still worse than whites. We're still living in a time where there are vast differences, and these differences directly relate to what's going on in Louisiana right now and the seriousness of COVID-19. One thing I want to step back and say is that our governor took the heroic step and expanded Medicaid. When I explained to you that we would be in so much more of a dire circumstance had we not expanded Medicaid, which has allowed hundreds of thousands of people to be able to get primary care. Black people, white people, everyone has been able to achieve at some point the ability to get quality primary care, and that is cause for no concern. And now we must address systematically and modify emergently how we live, work, and play, so that these social determinants of health will be demolished when it comes to the seriousness of the African American issues in our great state. What will happen now? This is what I've been asked. What will happen now? Well, we know that the curve will probably flatten. We want you to hunker down and double down and do what you need to do. This office and all the medical professionals will make that happen. But it may rear its ugly head again. And if it does, we need to be ready. African Americans, listen. We need to be ready. We need to eat better. We need to decrease our salt. We need to decrease our sugar intake. We need to quit smoking. We need to exercise 30 minutes a day. Decrease our stress. The reason why you must decrease your stress is because when you have a stress syndrome, your cortisol level goes up, your epinephrine goes up, which makes your immune system go down. So the more you stress, the more you panic, the more apt you are to get this horrible disease. We want you to understand that when you panic, what you do is you think that there's no constructive, serious thought going on to make sure that this disease goes away. But I must tell you that through our agencies, there is a lot of quality education and quality thought going on behind the scenes for us to be able to get rid of this horrible illness. we will win. I guarantee it, we will win. With this man and this man behind us, we will win. And I want to thank all of you, because without you, we will not be able to win, and you will all help us. I want to leave with a quote from an African American, as I started with a quote from Thomas Paine. And the quote is from a scholar, Benjamin Elijah Mays. I want you to think of this as a job. What challenge I've given you, it's a job. And Benjamin Elijah Mays said, I want you to do your job so that no one living, no one dead, and no one yet to be born could ever do it better. I don't want you to have any pressure because of that, but I want you to do what we say and know that we are going to support you with the messaging and the outreach that you need through the agencies of this great state. Thank you very much, and I'll take some questions. Yes, ma'am.
In terms of, I mean, obviously the things that need to be addressed here, a lot of those are long-term factors that can't be, you can't turn a switch and fix them quickly.
Exactly.
So are there any short-term things that can be done to help minority communities to combat coronavirus at this point?
Yes, and I think that's the most important question, because the studies all show that when people want to hear things from you so that you can actually have an action item so that they can actually do it, it needs to be done in a way that they understand, they can relate to. So we can have Dr. Anthony Fauci come here and speak to African Americans all day long, but sometimes that message will not resonate because Dr. Anthony Fauci doesn't actually know the African Americans in the Louisiana community. And that's what we're doing with the state agencies, to be able to provide that messaging, because things are a lot different now. People know what they need to do for all practical purposes. They need to be inspired to move and do them. And my job, and this agency's job, and our state's job, is to inspire the people to do the things that we need. Sometimes they're simple and sometimes they're complex. However, no matter their complexity, these must be done for us to flatten the curve, for us to make sure that our data, because we have never been at this point, because this is a novel virus. But what we do know is the behavior of coronaviruses throughout time. And what we know is that because you have no immunity at all to this virus, no one does, no human. When it started, now some people do, obviously, but when it started, no one did. So as you get it, you have to make so much antibody to kill it in your body so that you can coexist and you can live, that the probability of you having so much antibody and not being protected, that's going to be very, very low. So what we think in our estimation, what we think in our experience, from our experience, is that this will go away. You will be protected for this season. But for next season, meaning next spring, we're not sure. Just like with influenza, we have to get protected up until next season, and then we have more work to be done. Any other questions?
Thank you very much, Doctor.
Thank you very much, Governor.
Okay, Greg.
Governor, as you talked about the money from the federal legislation arriving to supplement the state's unemployment, is that your understanding that's retroactive? And also, what is your understanding from your secretary about how long it's taking for people to apply, even if they went to the non-peak hours?
Well, I can't tell you. I know multiple times during the peak, they unemployment through the CARES Act. It's pandemic unemployment assistance, and it's not just available for those people who would traditionally qualify for unemployment benefits, because typically 1099 contract workers, self-employed workers, gig workers, they wouldn't qualify for that $600 a week. And so we are going to start getting those checks out on Monday, and they will go through that time period. It is really important for everyone to do their initial claim file, but also to weekly recertify, because the law requires them to recertify. I know it goes through July 31st. We do have some people who've applied for benefits over the last 3-4 weeks related. They go back and pick up that $600 a week. That, and I apologize, I'll get that to you. Yes, sir.
Governor, the trajectories of different areas of the state being different.
Huge. We actually put into place some mitigation measures, and so you didn't have that really steep rise in cases like you've had elsewhere. But that can always happen. If at any time the people of Louisiana decide that they're just not going to follow the mitigation measures, they're not going to obey the stay-at-home order, do proper hygiene and so forth, these cases will spike, whether that's in Baton Rouge or in New Orleans or wherever. That's going to be the result.
Do we know if you anticipate we're going to hit a point where within the 2-week modeling that you guys have, the Baton Rouge region will show it's going to exceed its capacity for hospitals or events, or do you think we've avoided that?
No, I can't say that we've avoided it, but I don't want to say that it's going to happen either. Right now, what I can tell you is the modeling does not show that we will exceed bed capacity or ventilator capacity anywhere in the state of Louisiana in the next 10 days. When you start trying to get beyond the 10-day period, you're really guessing more than anything else, and I don't want to engage in that. And look, I recognize that what I just said is very different than what we said last week. That's because we have different facts this week. And it's not just modeling in Louisiana that has changed dramatically over the last several days. Look at the modeling for the country as a whole. This is what we're seeing. And the improved forecast, if I can call it forecast, the improved modeling, those numbers of total cases and deaths that we think we will see, they are all premised upon us continuing to do the mitigation that is currently in place. And so if we want to get back to where we exceed our capacity to deliver health care, if we want to get back to where we're going to have patients who need a ventilator and can't get one, all we have to do is resume our normal daily activity, stop following all of the mitigation measures, and that's what's going to happen. So that is my number one message to the people of Louisiana is thank you for what you've done thus far. For those of you who haven't, I'm asking you to get in line and start staying home. Only go out when it's essential, and don't do that more frequently than is necessary. And when you go out, wear that face covering. If you're going to be in close proximity to others, social distance to the maximum extent possible, and use hygiene. The practices we've talked about, washing your hands frequently and for 20 seconds with soap and water, hand sanitizer when you can't get to soap and water. Make sure you cover your cough. Stay home when you are sick. No matter whether you think you have it or not, stay home if you are sick. Yes, sir, Leo.
To follow up on this question, East Baton Rouge Parish is still only 25% of the test rate of Orleans, and yet East Baton Rouge is the most populous parish in the whole state, more than 40,000, or 40,000 more than Orleans. I realize that the hot spot was in Orleans Parish. But why is it taking so long to ramp up and get test results back for East Baton Rouge when you have more people living here than in any other part of the state? We're half the rate of testing in Shreveport.
Yeah, first of all, we're hopefully testing people who are symptomatic. So if we're testing symptomatic people, we're testing symptomatic people, and it doesn't have so much to do with how many people live in any one particular area. And that's been my charge to the Department of Health, working with all of the hospitals and clinics, is that we're going to do as much testing as possible, but within the proper protocols. As we've mentioned before, if we administer these tests to people who are asymptomatic, the result is not going to be reliable, and therefore someone could actually have the virus, have the disease. They'll be told that they don't, and they will potentially not engage in the mitigation measures and social distancing, the quarantining and isolation that they should. But you know, nobody is happy with the amount of testing that we've done, because we want to have more visibility, not less. But I will tell you, Leo, we've done more testing per capita than any state in the United States of America. And we're trying as hard as we can to test those individuals who need to be tested. And we're going to continue to increase that capacity. And as new and better tests come online, we hope to get results in much, much quicker. 95% or so of the testing that we've been reporting over the last 10 days or so is coming from commercial labs. And as you know, they've been reporting that their volume has just caused backlogs, and so we're not getting those results as fast as we would like. they're doing better, and we're talking to them about doing better, and we're trying to get different clinics and hospitals to move away from those testing companies that are slow with their results and move towards those that are faster. So I'm not saying that we're satisfied with what we've been doing. We're trying to do better, but we're trying to make these tests available all across Louisiana to the people who are symptomatic and in those categories that we talked about. Yes, sir.
Going back to those $600 federal unemployment checks, for gig workers who we've talked to in the past few weeks who obviously haven't been eligible, and they've been denied, obviously, is all they need to do is apply now, it will go through, and then as far as the workers who have already gotten unemployment, they don't need to do anything else.
They do not have to do anything else other than recertify every week. And so if you had an initial application from someone who's a gig worker and it was more than a week ago, I would tell them that they need to recertify. But the process will look very similar with respect to those people who qualified for traditional benefits and those who didn't from this point forward through July 31st, because the benefit runs out at that point. Yes, Jeff. I'm coming back to you, Melinda.
Obviously, this weekend is a big family weekend. What would your advice be to families? I mean, could you do a crawfish boil, still social distance? And then another question for you. Another question, I've heard government leaders answer this question, and kids are asking this. Is the Easter Bunny an essential worker?
Well, I hope the Easter Bunny pays me a visit.